Hello everyone, welcome to the certificate program on pharmaceutical quality assurance and quality control. The pharmaceutical environment is changing quickly due to the globalization, increased competition and such multiple reasons. Here you can see a market scenario which is being projected for 2024. The global healthcare market is going to increase by around 20% by 2014. This is a comparison between 2019 and 2024. Similarly, the patient handling equipment market. Now you know the scenario what has been happening with the COVID-19. Surely it is going to increase. So there is a much competition that is going to take place between the pharma company. So who is going to survive this fast changing environment? The people and companies that learn to adapt will prosper. Their focus will be to manufacture and deliver consistently zero defect product to the patients. So how we can manufacture? How a company can manufacture zero defect products? Quality control and quality assurance are vital to this success. So dear students, before going in detail about the course, I'll give you a brief information about quality assurance versus quality control. You may be always hearing about this, different job roles like quality manager, it may be quality assurance manager or quality control manager. So what is the difference between these two? These two are two different departments. Quality assurance involves the development and implementation of system that provides confidence in product quality and safety. So in quality assurance, there will be quality assurance of raw materials, quality assurance of auxiliaries, the quality assurance of equipment and instruments, quality assurance of products, etc. So all those steps of quality assurance are carried out before the industry phase. Thus you can think of quality assurance as a company based or a product based approach. To remember what is quality assurance, simply we can say like this. Quality assurance is GMP plus QC. What is GMP? Good manufacturing process. So GMP, good manufacturing process, is a part of quality assurance, and along with that we also will be doing the quality control. So normally quality control is a practical approach or lab based approach where we will be doing the testing of various products. It can be sometimes testing of raw material. You need to do the quality control of raw material, quality control of intermediates, quality control of products. So I think by this you might have understood quality assurance is managerial and quality control is corrective process. So those who are seeking to work or currently working in pharma industry, they need to undergo training on basic quality management system. So when you are working in a pharma industry, in any of this department, whether it is in quality assurance department or quality control department, you will be working in different job roles. It may be like QA manager or QC manager, or it can be quality assurance associate, quality assurance technician, process validation coordinator, QC chemist, lab analyst. So these are the different types of job role that people will be working in pharma industry or any quality assurance or quality control department. So this course provides students comprehensive knowledge in quality assurance and regulatory affairs. You can learn how to establish, how to monitor and impose a modern pharmaceutical quality management system so that the quality of end product based upon their intended use is assured. This course covers current principles of pharmaceutical quality management system, which include regulations like FDA, WHO or ICH guidelines. So coming in detail about the course structure, you can see that the entire course of quality assurance and quality control are being divided into 4 modules. You have module 1 to module 4. The module 1 is about quality tools and total quality management. So where we will be discussing about the pharmaceutical quality management system as well as the total quality management. In the second module, we will be discussing about the current good manufacturing practices, CGMP, and also a brief description about the good documentation practices. The module 3 describes about good laboratory practices and the need of implementing clean room technology into the production facility. Module 4 speaks more about the regulatory affairs, about ISO 9000 series, ISO 14000 series you can learn, and ICH GCP guidelines we will be briefly explaining here, as well as to cover the Indian scenario we will be also discussing about the Schedule Y. So this is a brief course description. So you will be having 4 instructors for each module. Myself, Srijesh, Assistant Professor, Department of Postgraduate Studies and Research in Biotechnology, St. Aloysius College, Mangaluru. I will be dealing with the second module, that is about the good manufacturing practices as well as the good documentation practices. So what you need to do is to access the video lectures, you have to log into our e-portal, SAC e-learning portal is there. You need to log in here and you can view the videos. After viewing the video lectures uploaded by our faculty members on this particular platform, you need to complete the required assignments and quizzes. For each module there will be assignment as well as the quizzes. Whatever is applicable, you need to complete it. And there will be also a final assessment. Those who complete the required credentials will be awarded with an e-certificate at the end of the course. So delegate will leave the course with a clear understanding of how to successfully integrate GMP, ISO 9000, ICH principle. Wish you a good learning. Stay safe, study anytime, anywhere. Stay tuned.